My name is Heijman and I'm an employee of Philips Research. I'm working already the last 4 to 5 years at the Academic Hospital of Cologne, and on behalf of them, I would like to present this paper. Within this paper, we would like to introduce a new way to how we could evaluate hyperthermia, MR-HIFU hyperthermia treatments. I would like to thank the Focus Ultrasound Foundation for their bravery to organize this online meeting, and it's really appreciated. During the last first S meeting, we presented a case where we did 3 times hyperthermia within a patient with a dedifferentiated liposarcoma using a multi-position cell, which consists of 7 subcells. The individual subcells are electronically heated, and the transducers move between the subcells to heat at least a volume of 32 milliliters. What we asked ourselves was, how could we summarize this data and compare the individual sessions we had within these, for this patient. And what you could do is to look at the controller level, so more technical performance of the hyperthermia period, where we look to rise time, but also to the stability of the hyperthermia temperature during the treatment, which can be maybe calculated by the mean or standard deviation. But you could also look at the biological level. And recent papers have shown that there's a good correlation between the thermal dose based on T90 or T rise and the therapeutic outcome. And in those publications, mainly we used RF hyperthermia plus radiation therapy. Since we measure the temperature maps continuously at a very high temporal and spatial resolution, this could be a unique opportunity to calculate the thermal dose within each pixel for each time. And this thermal dose can be calculated with the above temperature, which is a formula which was published by Separata and Dewey already in 1984. But this is not a performance way, because the thermal dose is very depending on how long you would do the hyperthermia period. To make it kind of evaluated value, we thought we could calculate a ratio between the actual provided thermal dose and the thermal dose we have foreseen using the target temperature, which was set in the controller. And this is then called the thermal dose performance, which is just the ratio between those two. The problem with this is that the TDP is not very linearly and also not very intuitive in its value. And to make that more intuitive and also linearize it, we thought we could calculate then from the thermal dose performance, the thermal dose performance temperature. So this is then the best of the stable temperature you could use then to generate the thermal dose performance. We calculated this already for all the treatments we did with this patient. So in the top left images, you will see the mean temperature in the 3 slices in the target area. And in the bottom left, you'll see the thermal dose performance temperature. And it's clearly visible that the thermal dose performance temperature gives some more information, for instance, also in the areas where the whole 7 subcells were heated first when starting the whole treatment. On the right side, you see the 3rd treatment. There we had clearly didn't reach the mean temperature in that sense. And the thermal dose performance temperature shows really nicely some areas which we could not detect, where we still had spikes or other issues with the controller. The downside is, of course, that if you calculate this TDPT, that the noise is not weighted equally, and that target temperatures above the target temperature are very highly penalized in that sense. The nice thing is that the whole temperature curve can be used, so we don't separate the heat up phase and the maintenance phase, and that the thermal dose performance temperature could also be directly evaluated from the temperature curve itself without first calculating the thermal dose performance. Keep in mind, this is a proposal. We don't have any idea if this could have an influence or a predictive value for the induced therapeutic effect. But we think the thermal dose performance temperature could be a very intuitive and powerful predictor to summarize the biological performance of MR-guided high-intensity focused ultrasound hyperthermia treatments. With this, I would like to conclude, and I would like to thank the team, especially Holger, Sinjun, Lucas, Stephanie, and Marcus, at the University Hospital of Cologne for some great years, and where we did some great work in pushing the MR-HIFU technology into a clinical translation.